Let us see today how an anti-scan is performed. Today we know anti-scan which is an integral part of the first trimester assessment of pregnancy at risk, is becoming universal recommendation, and all pregnant women should be offered first trimester screening during their pregnancy. Anti-scan is an important part of first trimester screening, and we will see how technically the scan is performed. However, there are certain requisitions for doing an anti-scan. Number one, the sonographer should be trained appropriately by the Fetal Medicine Foundation. And when you go through their online course and submit your set of images, they will certify you and you get a number, sort of a license number, and that tells you that your ultrasounds are accredited by Fetal Medicine Foundation. Then certain measurements that we take, and these measurements will go into a software which is again provided by the Fetal Medicine Foundation, and this software will calculate the risk associated with this pregnancy, like what is the risk of this baby having Down syndrome, etc. So in the short presentation to follow, we'll see how to generate a good quality anti-image. Of course, the details about the anti-scan has already been discussed in the chapter. We'll just see about some practical aspects of how to do an anti-scan. First parameter to measure is CRL. This is called as neutral position. Both fetal ends, that is the cephalic and polaric ends, are nicely seen, and we place the calyx. Second is to optimize our image for a good nuchal translucency measurement. Obtaining such good quality images is not very difficult. A small learning curve for obtaining good images is necessary, but you will learn it easily. So how do we do about it? So begin the scan. Now this is a small image. We magnify, then put the zoom box so that only head and the upper part of thorax is seen on the whole screen. Once we get an appropriate image, we freeze and we can see both the parameters, the nuchal and the nasal bone, and the horizontal lines of the plus marks are placed exactly on the inner border of nuchal translucency. And we also measure the nasal bone. Of course, nasal bone measurement is not required. It is only presence or absence of nasal bone that is important. Then third parameter will be ductus venosus, and we can see a nicely ductus venosus here, and the ductus venosus flow. The upper one is the positive A image, positive A wave, while the lower is the showing the reversal of A wave. So ductus is one more important marker of aneuploidy. The fourth parameter will collect is tricuspid wall, and this is how tricuspid devastation is seen. These are the positive A waves denoting a normal tricuspid wall function. Last but not the least is measurement of uterine RT-PI. And when all things are entered into the software provides us valuable information about the patient's risk of having an aneuploidic gestation, what is the risk of developing preeclampsia before 34 weeks and before 37 weeks, what is the chance of fetal growth restriction, and what is the chance of spontaneous delivery before 34 weeks of gestation. For example, in this given test or given patient, her risk of developing early onset and late onset preeclampsia as well as fetal growth restriction is on the higher side, and therefore aspirin is being recommended. This is a complete anti-scan report or a complete FTS report. This is how the possibilities are interpreted. Always consult your local fetal medicine consultant to read the report properly. If the patient has got high risk for aneuploidy or preeclampsia or fetal growth restriction, or the risk of spontaneous preterm birth before 34 weeks is on the higher side, she will require some form of intervention. Ultimate aim of a good first trimester screening program is to identify those women who are at risk early in the gestation and offer them early specialist care, which will begin right at 12th week itself. This concept of reversing the pyramid of antenatal care has been promoted by Dr. Nicolaides and is a valid way of offering a newer antenatal care to our pregnant women.